Researchers Patmon et al. Set out to explore how the use of interactive patient engagement technology, also called IPAT, in the inpatient setting affected the nurses using them, and if it could also be used to increase the participation in the patient's care, which could lead to increased patient quality of care. The goal was to encourage patients to take part in their care using the iPad, as it had been shown in earlier studies to have great impact on patients' satisfaction, experience, and health outcome. 2 hospitals in California were selected for this experiment, where 38 nurses from each hospital were interviewed on their feelings of the use of the iPad system and how it affected their everyday practice. Nurses from the ED, Medical Surge Unit, and Family Birthing Center were selected to take part in the study. To begin the study, the research team conducted a literary review in order to better understand and develop their methodologies for the study. Observations of the nurses then took place as they interacted with their patients. Observations of the patients also took place of them using the iPad, and they were documented as well. Next, interviews of the patients and nurses took place. Using the Lit Review, an interview guide was developed to best answer their questions. Lastly, there was a data analysis to see if the implementation of the iPad system was successful in the inpatient hospitals and if nurses really did enjoy using them. The results found that during the experiment, it showed that there was a great success in incorporating the iPad into the hospital care setting. Also, that nurses using the iPad found that it helped them in their daily practice, which improved the patient's quality of care. It was also reported that the iPad system could be used as a distractionary therapy. From this article, they also found that increased training needed to be used to improve the use of iPad within more of the nurses. Thank you very much.